Joining us today is our special guest from RWJBarnabas Health. Dr. Mike Jaronczyk is the medical director of bariatric surgery at Community Medical Center. Good morning, doctor.
Hi, doctor.
Good morning. How you guys doing?
Great. How are you?
Doing well. Thanks for having me.
So, doctor, why and when should someone consider having bariatric surgery?
So right now in America, morbid obesity is a significant problem. And patients that have morbid obesity, especially ones that have certain diseases like diabetes, high blood pressure, sleep apnea, liver disease, those patients are perfect candidates to have the surgery.
And who is a candidate for bariatric surgery?
So typically what we look at in patients is something called body mass index, or BMI. And you can easily calculate that on Google, reference of height to weight for all patients. Anyone that has a BMI of more than 35 or a BMI of more than 30 with a significant disease, those patients are candidates for the surgery.
Wow.
So, doctor, are there benefits to having bariatric surgery in addition to losing weight?
Absolutely. So the weight loss is a almost secondary benefit. That is not our main goal for our patients. The obesity epidemic is really, really dangerous because of the diseases that come along with it. So that's what we're really trying to do. We're trying to take these patients that have all these diseases, that have these risks of early death, and we're trying to alleviate all of those things. Taking less medications or even no medications, getting rid of their diabetes and their high blood pressure, getting rid of their sleep apnea.
Right.
And patients will feel better overall. The weight loss is all part of that, but that is not our main goal.
And how does a person get started in this?
So they can easily call us up at one of our centers, and they can even go online for more information and know through our online portal at RWJBarnabas or RWJBH.org. They're able to look up any information they want on me or any of my colleagues. We have a very robust program with a lot of nurses and other providers, dietitians, and all that are willing to help and ask any questions or answer any questions they may have. And they can just give us a call and let us know that they want to see us, and we'll be more than happy to see them.
Doctor, what sets the weight loss surgery program at Community Medical Center and Monmouth Medical Center apart from others in the area?
That's a great question. So we have a lot of very well-trained surgeons. Some of them are pioneers that have been doing this for several decades, pioneers in the field of bariatric surgery. And as I said earlier, we have a robust team with dietitians or nutritionists and nurses that are specially trained and certified in bariatric medicine and surgery. And aside from the surgery, we do offer medical weight loss plans as well. One of our really important things for our program is we see a lot of patients that have been seen or treated by other surgeons in the area, other programs in the area, and then for whatever reason their insurance is not taken anymore, or they've broken apart from those surgeons, and we will welcome those patients with open arms because we want to take care of those patients whether we've done the surgery on them or not. And it's very common as well in the bariatric field to see a surgeon in the office and you may not know who's going to be doing the actual surgery, who's going to be operating, and who's going to be taking care of you afterwards. We make it a point that the doctor that you're seeing in the office is the doctor that's doing your surgery, and that's the doctor that's going to be taking care of you after surgery.
So I know there's different types of procedures, but how do you know which is best for you? And what are they?
Right, so that is something that we talk to all our patients about. Our two most common procedures are the sleeve gastrectomy, where we take out most of the stomach. The other one is the gastric bypass, where we don't take anything out, we just make the stomach smaller, and we rearrange the intestines a little bit so that you're not absorbing everything that you're eating. And usually this is done on a case-by-case basis. I will say that the sleeve is the most common surgery that's performed in our practice in the state of New Jersey, in our entire country. But the gastric bypass is still a very common surgery that we perform.
For more information, visit rwjbh.org/weight loss. For information about the Center for Bariatrics at Community Medical Center, call 732-557-8966. Dr. Mike Jaronczyk, thanks so much for joining us today.
You're helping a lot of people, doctor. Thanks.
I hope so. That's our goal. Thanks for having me. I hope you guys have a great day.
You too.